we have also been working on a separate but related program of research called Whole Body Hyperthermia, in which you put an individual in a device, and you could either do it in a sauna or you could do it in a medical device. We have both, and you essentially just raise their body temperature. And they have a thermometer in their body, and you are monitoring their core body temperature and bringing them up to, in this research, the temperature is 38.5, which is 101 Celsius, which is 101.3 degrees Fahrenheit. And so you bring them up to temperature, and then you leave them in the device for 60 minutes. And during that 60 minutes, you turn off the heat. However, their body temperature keeps rising a little bit.
So what conclusions are you drawing from that?
So that I was not on the team of people that did the original work with this. There was a randomized controlled trial published in 2016 in JAMA Psychiatry. And we are working now with an investigator by the name of Charles Raison. He goes by Chuck, and he's at the University of Wisconsin. And he's the last author on this article. And basically this is a very cool article because they compared whole body hyperthermia, and it's one treatment. So it's not repeated treatments, it's this one treatment. He compared that active treatment where you bring someone up to 38.5 Celsius, leave them in for 60 minutes, and that's the treatment. And then he put them in, or they were randomized to sham. And in the sham, you don't put on there's heaters, central heaters that come right through your chest. You don't turn those on, you just turn on these leg coils. So it's warm, and they get a little bit warm. I think they got up to like 37 degrees Celsius or 37.6 or something. So they're getting a little warm, but they're not getting up that high. That's a different issue because it ended up being more low temperature versus sham. So he was actually trying to go for sham, but he didn't realize that there's all this thermoregulatory dysregulation in people with major depressive disorder. That's sort of the theory they're using in this work. But anyway, he compares these two groups, and I think there were 30 people randomized, so it's a fairly small trial. The effect sizes, so after 1 week, the effect size was over 2, which is like, I don't know if you know effect sizes, but it's like antidepressants, their effect sizes are usually like 0.3 to 0.4. So 2 is like unheard of in psychiatry. It's like blow your mind, like holy moly. And that effect size stayed over 1, which is still huge, for 6 weeks. So those two groups stayed separated, and there were these huge effect sizes out 6 weeks from the treatment.
And those effect sizes are in relationship to?
So it was the same thing. It was depression scores on a gold standard clinical interview with a clinician.